this brief clinical correlation, we'll be talking about nasal polyps. Nasal polyps are small sacs or little outgrowths. They consist of inflamed nasal mucosa. Usually these polyps will originate, as you can see in here, we have tried to put some little growths into the nasal cavity. So usually they will originate from the ethmoid ear cells or the maxillary sinus, so a little bit further laterally here. You can see these growths here, and as they open into the areas where we have air passing through usually, well, they can cause airway obstruction. So they are especially frequently seen in patients that have asthma or allergic rhinitis, which is just a different term for hay fever, right? And chronic sinus infections. These polyps can be completely idiopathic, so they might not be a problem at all, so you don't have to do anything about them. However, children that have nasal polyps almost always have cystic fibrosis. You can see over here in the photograph A, you can see there are some nasal polyps obstructing the right nares, so the airway on this side. And here this is a coronal computer tomography image where you can see the maxillary sinus, which is this space over here. And here's the left maxillary sinus, and you can see that here is a large mass in here. This is a maxillary sinus polyp. And over here you have a swelling of one of the conchae, seems to be between the inferior and the middle concha. It's also called a turbinate. Yeah, well, with a swelling this large, it seems quite likely that you have significant impairment in your ability to breathe.